Well, welcome back to 104.7 Rossendale Radio. It is time for the Tuesday morning health bit, and I'm joined this morning by Catherine Rutland, who is the Clinical Director at Simply Health, and Nigel Carter, the Chief Executive of the Oral Health Foundation. Good morning. How are you doing?
Good morning. Very well, thank you.
Good, thank you.
Now, we're here to talk about the fact that it's Mouth Cancer Awareness Month, and it was really some of the statistics that have come out from the study that's recently been published, that over half of us don't know how to check ourselves for mouth cancer, and more than a quarter don't know what the potential early warning signs are of mouth cancer. And I've got to say, I'm very much in those statistics, that I'm going to be educated this morning. Let's start with you, Catherine. What's this study shown about how we're very much unaware of our own oral health?
Yeah, I think it's something that we've been aware of. This campaign's been running for 21 years. And although we have managed in that time to increase awareness, it's still, as you say, quite shocking, still that lack of awareness of checking yourself out and understanding what you normally look like. So we're very used to it in other cancers, breast cancer, prostate cancer, and so on. We've all been educated in what to look out for. But mouth cancer, still, though it's a rising rate, is still very poorly known as to what to look for. We tend to think of our mouths as teeth and gums, and we don't think about the soft tissue that goes with it. You can look yourself, you can check yourself out, make sure you know what is normal for you, so that if you know what's normal, you then know when something isn't right, and then you should go and get it checked out. So I think that's the most important thing, is that awareness of what is normal, and then you can start to look out for what is not normal.
I suppose that not normality is that it's the usual thing. If you don't notice something's wrong until it's different, but actually there are pre-warning signs that we could look out for. And the advice is to check yourself early in the morning. Nigel, is this what, just that while we're doing our regular routines of brushing our teeth?
While you're doing your regular routines, doesn't necessarily need to be in the morning. It's not something that changes during the day, but at some time to check on a regular basis. And we're looking here for ulcers that don't heal within a period of about 3 weeks. Now, most of us get mouth ulcers at one time or another. They heal up generally in a week or so. Nothing to worry about, but it's the ones that are persistent, that don't heal, really, they need checking out. Any unusual red or white patches in the mouth, particularly if they're changing shape or growing. Any lumps in the head and neck area, so along the jawline down into the neck, if there's any unusual lumps coming in those areas. Persistent hoarseness. These are all reasons why we might want to get along to the dentist or doctor. And we always say throughout this campaign, if in doubt, get checked out. It can improve survival rates so much, detecting these mouth cancers at an early stage.
It is, and unfortunately, in the last decade, we've seen the diagnosis of people suffering from mouth cancer. It's risen, hasn't it, Catherine?
Yeah, and that's what's really worrying. That we're seeing this huge, almost doubling in rates in the last 20 years, but also the death rates as well. And that's really scary when you think of a lot of cancers where we are improving prognosis over time. And why we're seeing that a lot of the time is that these are being diagnosed really late. They're being diagnosed at the stages of stage 3 or stage 4, when actually they've started to spread to other areas of the body. And of course, that makes it much more difficult then to treat, and therefore the life expectancy drops accordingly. So it's really important that we're looking out for those very early signs, as Nigel says, so that they can be diagnosed earlier. And at that stage then, it is something that you can sort out and continue your life. But if you leave it too late and worry, or don't pay attention to it, or think it will go away and don't get checked, then you are really pushing, literally dicing with death as to how far you push that out. And as I say, the treatment then becomes much more radical and debilitating as well.
And that's the thing, is that it's the same with, I suppose, all of these various different types of cancer. The earlier these things are diagnosed, the more successful the treatment can be, isn't it? Because these are treatable cancers, aren't they, Nigel?
Yep, they are indeed treatable, but it is a question of catching them at an early stage, because if you get to later stages, the treatment can be quite dramatic in terms of taking away big chunks of the tongue or of the jaw. And it's not even the treatment and whether you're surviving afterwards, it's your quality of life because of the nature of the treatment. So, you know, getting this early diagnosis, getting relatively simple treatment in place, it's going to give you so much better quality of life afterwards as well.
It's something that we all need to be taking sort of much more care over. Bizarrely, I've actually got an appointment at the dentist just today, so it's become very relevant for me. So I'm going straight off to do all these checks. So just run me through the routine. What sort of thing can I be doing just to you know, I'm going to brush my teeth anyway. What can I be doing to just check out for my own oral health?
The big thing is get yourself in front of a good mirror with a good light. Obviously, that's the first thing. But what you want to be then looking at is your tongue. So you might feel a bit stupid standing there with sticking your tongue out at yourself.
I never feel stupid with my tongue out.
So, but you know, that's the thing. Stick your tongue out, have a good look either side of your tongue, your cheeks, inside your cheeks, you want to have a look, and at the back of your throat. It's quite difficult to see the back of your throat, but see if you can see as far back as you can. And also just looking around, pulling your lips back. Sorry, I'm doing all the demonstrations and I'm on radio, aren't I? So
great for radio.
That's not very helpful. But pull your lips back and really just have a good look at your all your soft tissues in your mouth to see what they look like. There's a great little video. There's a website, mouthcancer.org, that's got a huge amount of information on there, and on there is a little video that will show you exactly how to do it. So it's really worth going and having a look at that. Video will show you what to do, so there's no excuse then. You'll be all fired up and ready to go.
Oh, it sounds like there's absolute guidance out there for me. I'll go and check it out. So it's thank you very much. It is Mouth Cancer Awareness Month, and we will do our best to make sure that we're keeping fully informed of things. Thank you very much to both you, Nigel and Catherine. Now you've chosen the playlist for us today. We played into the segment with your choice of you said anything 80s for us as Catherine, so we went for some Depeche Mode for you. Nigel, you decided to date it just a little bit further back. You thought the 70s would be perfect for yourself.
Absolutely.
Well, it just so happens that Dave Metcalf is up with the 70s hour later on. I think he would very much agree with our choice of 7 Seas of Rye. Thank you very much, Catherine Rutland and Nigel Carter.
Thank you very much.
It's been a pleasure.